Have you noticed a new curve, a hard lump, maybe painful erections, or just a really sudden change in shape? Well, if you have, you're in exactly the right place. Today's explainer tackles Peyronie's disease. We're going to break down the actual clinical facts to take away that fear of the unknown. We'll look at exactly what's happening inside the body, why it happens in the first place, and most importantly, what you can actually do about it. I know that seeing these specific physical changes, like an hourglass narrowing, feeling a hard lump right under the skin, or noticing a sudden bend, can be incredibly stressful. Honestly, it's scary. But understanding that these are very common, well-documented symptoms is literally the first step to taking back control. Because we know these symptoms can cause a ton of anxiety. Here's our quick roadmap for today's explainer. 1. Recognizing the signs. 2. Causes and risk factors. 3. The 2 stages. 4. Exploring treatment options. 5. Penile traction therapy. And finally, 6. Next steps. Okay, let's jump straight into section 1, recognizing the signs. What exactly is happening? So the medical term we're dealing with here is Peyronie's disease. But simply put, it's essentially a wound healing disorder. You see, inside the penis, there's this tough, fibrous sheath called the tunica albuginea, and it's designed to stretch when filled with blood. But in Peyronie's disease, rigid, flat scar tissue, which we often call plaque, forms right inside this sheath. And because that scarred side is rigid and can't stretch anymore, it basically acts like an anchor, pulling the tissue and causing a bend or an indent when an erection happens. And as you can see here, the physical changes can vary a lot from person to person. You might experience an upward, downward, or sideways curve. Sometimes it's a 30-degree bend that kind of looks like the hands of a clock pointing to 1 o'clock. Other guys might see more of a bottleneck or hourglass shape. There can also be a loss of length, sometimes equivalent to a stack of 50 to 150 sheets of paper, which is significant. In some cases, calcium even builds up in that plaque, making it feel literally as hard as bone, which can unfortunately lead to painful or softer erection. But here is the absolute most crucial point. You are not alone in this. I know it can feel incredibly isolating, but clinical estimates show that up to 10 to 15% of men between the ages of 40 and 70 actually have Peyronie's disease. That is a massive number of guys. Yet, because it's such a sensitive, personal topic, a huge portion of them just suffer in total silence out of pure embarrassment. Let's move on to section 2, causes and risk factors. Why does this actually happen? Well, most medical experts agree that this scarring actually happens after microscopic injuries to the tissues. Now, we aren't necessarily talking about some massive, painful accident here. Often, these are just minor, completely unrecognized microtraumas that happen during normal, vigorous sex or athletic activities. The body obviously tries to heal these tiny tears, but for men with Peyronies, it triggers an abnormal wound healing response, creating tough scar tissue instead of normal, flexible tissue. Now, what's really fascinating here is that not every single micro-injury leads to Peyronie's disease. Your own unique biological makeup plays a massive role. So things like your age, especially being between 40 and 70, or genetics, like having a father or brother with the condition, definitely increase your odds. Connective tissue disorders are a huge red flag too. For instance, some guys might also have Dupuytren contracture, where a thick cord pulls their fingers inward. And conditions like diabetes-related erectile dysfunction or autoimmune diseases can also significantly elevate your risk. But before we go any further, let's just completely dismantle some common fears right now. When you feel a hard lump, it's so easy for your mind to spiral into dark places. So let me be super clear. Peyronie's disease is definitively not a sexually transmitted infection. It is not contagious. And it is absolutely not cancer. It's not going to turn into cancer either. What it is a benign wound healing disorder that causes a physical change in the tissue. And most importantly, it is a highly manageable condition. All right, section 3, the 2 stages, the acute and chronic phases. You see, the progression of Peyronie's disease is actually highly structured. It doesn't just keep getting worse and worse forever. It typically splits into an initial volatile window, which is the acute phase, from roughly 6 to 12 months, followed by a later stable window known as the chronic phase for anything past 12 months. Let's break that down. During the acute phase, so roughly those first 6 to 12 months, that scar tissue is actively forming. This is the volatile period where the curve or the indentation is gradually getting worse, and you might definitely experience pain during erections. But once you hit that chronic phase, usually past the 12-month mark, the whole condition stabilizes. The scar tissue actually stops growing, which means the curvature won't get any worse, and the pain usually goes away entirely. So, moving to section 4, exploring treatment options. Let's map out your choices. You essentially have a few main paths here. Medications, whether that's oral pills or injections straight into the plaque, can help reduce severe curves, but they rarely result in a perfectly straight outcome. Then there's surgery, where doctors might shorten the unaffected side, lengthen the scarred side, or place implants. But that's generally reserved for severe chronic cases because it carries heavy risks like permanent length loss or numbness. And then there's traction therapy. This is frequently recommended as a highly effective, non-invasive way to physically break down the scar tissue and help restore lost length over several months.
Which brings us to section 5, penile traction therapy, a non-surgical approach to remodeling tissue.
The mechanics behind this are actually pretty simple, but incredibly effective. By applying gentle, consistent external stretching to the tissues over a period of months, you actively encourage that rigid plaque to soften, break down, and stretch out. Think of it kind of like physical therapy, but for that localized scar tissue. You're guiding it to heal in an elongated state rather than a contracted, bent one. And when we talk about these therapies, this is where a device called Penisal comes in. Penisal is a non-invasive device specifically designed to provide this exact kind of controlled, progressive traction therapy. It offers a really logical, at-home option to help you manage these physical symptoms safely over time. It's built to apply just the right amount of gentle tension needed to encourage that tissue remodeling, all while letting you incorporate the therapy discreetly into your own routine. The difference in how your tissue responds is actually pretty stark. Without any traction, that scar tissue simply remains rigid and contracted, locking in the curvature and maintaining that length loss. But with progressive traction from a device like Penisal, the tissue gets physically stimulated. That gentle, consistent tension encourages the scar tissue to slowly stretch out, which really aids in improving the curvature and can help you proactively manage those symptoms. Finally, let's wrap up with section 6, next steps and support, taking action and regaining confidence. I really want you to take a second and look at this quote from the Urology Care Foundation. Guys, Peyronies is incredibly common, and it is absolutely nothing to be ashamed of. Yes, changes to your body can cause severe anxiety and strain your intimacy, but please do not suffer in silence when there are clear, non-invasive, and effective ways to manage this. You have options. The science of tissue remodeling proves that the body can respond when given the right guidance. So why let embarrassment dictate your quality of life? To learn more about the specifics of Peyronie's disease, dive deeper into penile traction therapy, and see exactly how Penisal works to help you manage your symptoms from the comfort of your home, click the link in the description below right now. Seriously, check it out and take that next step toward recovery today.